Hello friends, today we will discuss about the muscles of mastications. What are the muscles of mastications? Muscles which help in mastication are known as muscles of mastication. In this lecture we will discuss about the introduction, development, anatomy, action, innervation, vasculatures and conclusion about the muscles of mastication. Introduction of muscles. Traditionally, four powerful muscles, masseters, temporalis, medial pterygoid, and lateral pterygoid, are called the muscles of mastication. Accessory muscles are known, those muscles which help in the mastication are known as accessory muscles of mastication, which include suprahyoid muscles and infrahyoid muscles. In suprahyoid muscles, we have mylohyoid, geniohyoid, stylohyoid, digastric muscles. In infrahyoid muscles, we have sternothyroid muscles, omohyoid, thiohyoid, and sternohyoid muscles. Development of muscles of mastication. Muscles of mastication develop from the mesioderms of first brachial arch, that is also called the mandibular arch. Pterygoid muscles differentiate in the 7th week. It is related to the cartilage of the cranial base and the condyle initially. Later, as the bony skull appear, as increase in the width and length, the muscles expand rapidly. Temporalis muscles begin lateral development in the 8th week, occupying the space interior to the octic capsule. As the temporal bone begins to ossify in the 13th week, the muscles attached to it. Masseter muscles begin attachment to the zygomatic arch as it undergo lateral growth, providing space for muscles of development. We have now discussed one by one about the muscles of mastication. First of all, we will discuss about the lateral pterygoid muscles. Originate from the upper head of lateral pterygoid, origin from the infratemporal surface and crest of greater wing of sphenoid, and the lower head origin from the lateral surface of the lateral pterygoid plate. Action of the lateral pterygoid muscles. Superior head active during the power stroke. Power stroke refer to the movement that involve closure of the mandible against resistance, such as chewing and clenching of the teeth together. Inferior heads work at the depression, protrusion, and contralateral excursion. Depression depress the mandible along with the suprahyoid infrahyoid muscles to open the mouth. Protrusion, the lateral pterygoid acting together are the prime protector of the mandible. Contralateral excursion, unilateral, the medial and lateral pterygoid muscles of the two sides contact alternately to produce side-by-side movement of mandible, as in chewing. Nerve supply of the lateral pterygoid muscles. The nerve to the lateral pterygoid muscles branch off from the masseteric or buccal nerve, which is a branch of anterior trunk of mandibular nerve, supply the lateral pterygoid muscles. Blood supply pterygoid vessel from maxillary artery, branch of external carotid artery. Medial pterygoid muscles. Superficial head originate from the maxillary tuberosity and pyramidal process of palatine bone, and deep head medial surface of lateral surface of the lateral plate of pterygoid process and pyramidal process of palatine bone. Action of the medial pterygoids. Elevations bilateral. The medial pterygoid acting along with the masseter muscle are a powerful elevator of the mandible. Protrusion bilateral. The insertion of the muscle is posterior to its origin and therefore it helps in protrusion of the mandible. Contralateral excursion. The medial and lateral pterygoid muscles of the two sides contract alternately to produce side-to-side movement of the mandible, as in chewing processes. Nerve supply of medial pterygoid muscle. The nerve supply the medial pterygoid muscle is the medial pterygoid nerve, branch of mandibular nerve. Blood supply of the lateral pterygoid muscle is the artery supplying the medial pterygoid muscle is a branch of maxillary artery, which is a branch of the external carotid artery. Temporalis. Temporalis originate from the floor of the temporal fossa, inferior temporal line, all-lying temporal fascia of this side of the skull. Insertion margin and deep surface of coronoid process, anterior border of the ramus. Action: it can be divided into three distinct areas according to the fiber direction and function. The interior fiber are directed almost vertically. Elevation of mandibles occur. The medial fiber run obliquely forward as they pass downward, elevate and retrude the mandible. The posterior fiber are aligned almost horizontally. Retrusion of the mandible occur. Nerve supply: deep temporal branches of anterior trunk of the mandibular nerve. Blood supply: this is furnished by the medial and deep temporal arteries. The medial temporal artery is a branch of the superficial temporal artery, and the deep temporal artery are branches of the maxillary artery. Masseter muscles. Superficial layers originate its the largest components that arises from the anterior two-thirds of the lower border of zygomatic arch. Medial layer: the medial layer takes its origin from the medial surface of anterior two-thirds and the lower border of posterior one-third of the arch. Deep layer: the deep layer arises from the whole length of medial surface of the zygomatic arch. Action: elevation: masseters elevate the mandible to occlude the teeth in mastication. Ipsilateral excursion unilateral: as the origin of the masseter's muscle is slightly lateral to its insertion, a masseter muscle is slightly lateral to its insertion. A single masseter muscle can move the mandible to the same side. Retrusion bilateral: when the mandible is in a protrude position, the deep fiber are in the position to retrude the mandible. Nerve supply: supplied by masseteric nerve branch of anterior division of mandibular nerve. Blood supply: supplied by masseteric artery branch of maxillary artery. The masticative muscles include a vital part of the orofacial structures, are important both functionally and structurally. It is the crucial responsibility of a clinician to recognize each patient's muscular environment and be aware of the problems related with the excessive or deficient use of muscles and their bearing to the dentitions. Thank you very much.